I'm Dr Dave Rigby. I work at Langavat Medical Practice, which is on the Isle of Lewis, about 10 miles south of Stornoway. So I guess for us, I work as a GP in the Western Isles, and obviously we're quite remote. Population's 20-odd thousand, and we don't have a lot of on-island services. So trying to get people who have chronic pain syndromes the best treatment can be quite a challenge. And a lot of time what they actually need is a different approach, and Pain Association can provide that. They're not just looking at the medical aspects, they look at all the social aspects as well and think about the person at the centre, so give a much more holistic approach to managing pain. I guess as most GPs will sympathise with this, chronic pain is a big issue in primary care. We have multiple patients and they tend to represent time and time again. And I think one of the things we do know is that medication is not always the answer. But I think for a long time it seemed to be the only route for us and the quickest route. Having access to something like Pain Association gives us the opportunity to start the discussion with the patients to say, maybe your medication isn't the thing that's going to make you better. We're maybe not going to get rid of this completely, but we have ways that we can help you cope with chronic pain. It's been extremely positive. We've done, within our own practice, we've done a small survey of patients that we refer. Also patients who are on chronic pain medication, we've surveyed them and offered them the option to go to Pain Association as well, which a significant number of that cohort of patients took up the offer to contact Pain Association. The feedback from there is that it also helped decrease the reliance on medication. Often when they would have a flare-up of symptoms, they would reach for more medication, and that would lead to more side effects potentially, which could affect their daily function. You've got kids to look after, they've got work to do, whatever. So the feedback has been that the intervention of Pain Association means less reliance, more independence for them, and less side effects from what are potentially quite toxic drugs. So it's been overall very, very good. I think my experience, thankfully, is mirrored by the colleagues I work with, certainly in the Western Isles. I guess we're quite fortunate in that we've got such a footprint from the Pain Association now in the Western Isles. They provide regular monthly updates, they provide more detailed courses for patients, and there is that immediate availability when we do a referral in. Patients can contact the Society directly. So whilst I do think I'm an ambassador, I feel grateful that I don't really need to be, certainly in the area that I work in, because more and more people, I think, are buying into it regardless as the way that we need to work better.